Have you ever noticed an elderly member of your family walking with difficulty, with wobbly legs or complaining of weakness? This may seem like something simple, but the truth is that this symptom may be hiding something much more serious than you imagine. In many cases, weak legs are the first sign of silent diseases that progress quickly and affect the mobility, health, and even independence of the elderly. In this video, you will discover the most dangerous causes behind this problem, the warning. Signs that nobody talks about, and what you can do right now to avoid serious complications. Stay until the end, because what we are about to reveal could literally change the life of someone you love. When I see older people in my office, there are two situations that always catch my attention. The first is when the elderly person arrives in a wheelchair, but not because they really need one, but because they find it more comfortable and convenient. The second is when they have great difficulty walking, needing to be supported by a family member using a cane or dragging themselves along uncertainly. And then I ask you, do you know anyone who is like this? Someone who already feels weak in their legs, who has lost their firmness, balance, and confidence when walking? Well, that is exactly what we are going to talk about today. Welcome to another video here on the channel, where we talk about health, longevity, and a lighter and more conscious way of living. I am Dr. Robert, a physician, professor, and master of medicine for 17 years, and today's topic arose from something I see frequently in my consultations. What should we do when an elderly person starts to have weak legs and can no longer walk? Autonomously, firmly, and independently. That's what we're going to talk about now. And first of all, I want to emphasize, leg weakness is indeed a very common complaint among older people, and unfortunately it can directly impact quality of life, increase the risk of falls, and make the person increasingly dependent. This is a situation I see very often. An elderly person who used to be super active, participated in church groups, walked with friends, attended social gatherings, suddenly starts to avoid these environments. They stop going out, socializing, moving around. And what happens? This ends up causing not only physical decline, but also mental and emotional decline. It is a silent process that begins with weakness in the legs and goes far beyond that. That is why the approach needs to be comprehensive. We need to understand what the possible causes of this weakness are, and more importantly, act efficiently to intervene. And that is exactly what I will show you in today's video. In a clear and objective way, we will talk about what is behind leg weakness in the elderly, what can be done when it is already happening, how to prevent it from happening to someone you love. And at the end, I will also address an essential point that many people ignore, but that can make all the difference, a specific care that you need to take to not miss important signs. So let's get to it. The first step is to understand where this weakness comes from. What are the most common causes? One of the main ones is related to musculoskeletal conditions, such as osteoarthritis, which is wear and tear on the joints, especially in the knees and hips, and sarcopenia, which is the accelerated loss of muscle mass. In fact, I have a full video just about this, which I'll leave here on the card for you to watch later. There are also changes in the spine, such as a herniated disc, which can cause both pain and loss of strength. And of course, we can't forget the neurological causes, such as peripheral neuropathies, often caused by diabetes, vitamin deficiencies, strokes, or even diseases like Parkinson's, which are directly linked to loss of mobility. Other important causes include metabolic imbalances, such as vitamin D or B12 deficiency, anemia, hypothyroidism, as well as cardiovascular diseases, such as intermittent claudication, that feeling of weakness and pain in the legs when walking, which makes the person stop several times, and even heart failure, which can also cause a general feeling of weakness. And it doesn't stop there. Factors such as dehydration, use of certain medications, especially sedatives, and even mental disorders such as depression can cause this perception of weakness, even if the person's real strength is still preserved. Therefore, the perspective needs to be broad. Did you know that depression in the elderly often doesn't look like the depression we're used to imagining? Instead of deep sadness or constant crying, it can manifest as excessive fatigue, body aches, isolation, loss of interest in simple everyday things. And worst of all, many people think this is normal for their age, but it's not. Depression in older people is silent, underestimated, and can directly affect physical health, including causing or worsening weakness in the legs. And the most surprising thing? Sometimes it's linked to a simple lack of stimulation, affection, or active routine. Depression, anxiety, and even somatization, which many people know as tantrums, can indeed cause physical symptoms such as weakness in the legs. And the most interesting thing is that somatization is not just a popular name, it even has an official classification in the ICD-10 and DSM-5. It's real and really affects the body. In fact, if you think this is a topic that deserves an exclusive video here on the channel, comment below so I know. Now, when we talk about investigation, that is how to find out the true cause of weakness, it is clear that the first step is always to seek out your trusted doctor. In addition to talking and listening to the patient's medical history, a physical examination is essential to identify signs and guide the diagnosis. But what should you do after finding out the cause? Here, I want to show you some general measures that, in a practical way, are useful for practically every elderly person who is facing weakness in their legs, regardless of the underlying cause. The first of these is physical therapy. It helps a lot in strengthening muscles, training balance, and recovering autonomy. I will tell you something personal. My father-in-law was hospitalized for 16 days for a rare condition. When he came home, he felt extremely weak and always said, "Robert, I have no strength." And one of the first things I did was to start physical therapy with an excellent professional. And look, he has already started to report improvement. He is feeling firmer, more confident. This shows that the approach works. Another essential measure is to maintain regular physical activity. Walks, supervised whenever possible, and water. Aerobics, which are excellent because they do not impact the joints. I had a patient who told me that she was afraid of drowning in the water, and this shows how sometimes a simple belief can prevent progress. After I explained how the classes are done, she agreed to give it a try. Exercises with light weights are also great for improving strength and especially stability, which is just as important as strength itself. In addition, it is essential to increase protein intake, whether with lean meats, eggs, or supplements such as whey protein, always under professional guidance. Other interventions that may or may not be indicated, depending on the case, include vitamin D supplementation, generally between 800 and 2000 IU per day, vitamin B12, which can be oral or injected, and magnesium in some specific situations. If the cause of the weakness is diabetic neuropathy, the focus should be on strict control of blood glucose, and, if necessary, the use of medication for neuropathic pain. In osteoarthritis, treatment will focus on relieving pain and preserving joint function. The use of painkillers, anti-inflammatories, or even infiltrations may be necessary in some cases, but always under the guidance of your healthcare professional. In cases of poor circulation, the famous problem of vascular insufficiency, it is worth investing in good posture, wearing compression stockings and, if possible, using complementary resources. Here at home, for example, I recently bought 2 calf massagers because my wife always complains of pain in her legs after a long day at work. It is not weakness, but that persistent discomfort. And to our surprise, she has seen a great improvement. Later, I will leave here in the description the link to where I bought it, in case you are interested. Another strategy that can help is the use of supplements. One of them is HMB, a compound called methylbutyrate that acts to preserve muscle mass. I have already talked about this in other videos on the channel. It is worth checking out. And also the famous creatine, which has been shown to be useful for increasing muscle strength, especially in the elderly. Now, before talking about preventing complications, if you have come this far, take a second and like this video. Just click on that little button with a thumbs up. This really helps the channel because it shows YouTube that this content has value and can be shown to more people who need this information. And if the RUPA function is still active, click on it too and give me a score. This helps me rank among the content creators who deliver value to people like you. But let's move on. In preventing complications, a super important measure is the use of assistive devices such as walkers or canes. I know that many elderly people resist this, thinking it is a sign of weakness or that they are getting worse, but it is exactly the opposite. Just as wearing glasses improves vision, these supports help reduce the risk of falls and increase safety. Another essential thing is to adapt the house, remove rugs, improve lighting, and even use automation resources, for example, lights that turn on by themselves when they detect movement. This is great for those who need to get up at night, such as to go to the bathroom without tripping in the dark. Keeping the bedroom lit all night can also disrupt sleep, so these solutions help in several ways. Another key point, treating pain appropriately. Because if a person feels pain, they avoid moving, and this creates a cycle that only makes the situation worse. Sometimes, medication is necessary, and ongoing monitoring with a health professional is essential. There is no point in starting a strategy and never going back to reevaluate. I understand that sometimes there are difficulties, including financial ones, but whenever possible, do this monitoring. And finally, I need to talk about situations that require immediate attention. If an elderly person presents sudden weakness or weakness that affects only one side of the body, for example, it could be a sign of a stroke. In this case, go straight to the emergency room. Another warning: if the pain is very severe and is accompanied by numbness or loss of sensation, which here in the Texas countryside, people call forgetting the limb, that is when the arm or leg feels like it isn't there anymore, as if it were disconnected, this also requires urgent care. And if there is loss of control over urination or bowel movements, along with progressive weakness, it could be a sign of spinal cord compression, a serious condition that needs to be evaluated immediately. So, if you've made it to the end of this video, it's because you're really interested in this type of content, and that says a lot. So take advantage of this moment now and subscribe to the channel. And most importantly, turn on the notification bell. Only then will YouTube notify you whenever I publish a new video here. I've been trying to improve this channel more and more. Before I posted somewhat irregularly, not very often, but about 2 or 3 months ago I decided to really commit to this mission, and I started publishing 2 videos a week. My goal now is to reach 3 videos per week. And for that to be possible, I really need your support. Your subscription is more than just a click. It is the main metric that shows me that it is worth continuing to invest time, energy and dedication in this content production. So yes, I will continue on this journey, bringing videos about health, about how to age with a better quality of life, about longevity, and of course about a lighter and slower way of living. A big hug to you, and until the next video, bye.